Welcome as always. It's Tuesday, the 2nd of June. Now, the situation in the United States is of course alarming in its own terms. But it's also alarming because people have been emailing me saying, what are you talking about COVID-19 for? Don't you realise we've got other problems? And of course, regrettably, I do realise that. But of course, the pandemic hasn't gone away. These viruses are not, the riots are not going to affect the virus. The virus is just going to carry on. So I guess what my appeal would be don't forget that you're in a pandemic if you're in the United States, and carry on with all the day-to-day measures that you've been doing with a great deal of success. So the social distancing, carrying that on. The good hand hygiene, carry that on. The mask wearing, carry that on. Carry on all the good things you've been doing. Don't just say the whole thing's hopeless. You need to keep on carrying on doing these things. Because when these demonstrations and riots finish, the pandemic is still going to be here. So the note I've made here is the focus has shifted in the United States. And of course, that's understatement. But the pandemic has not gone away. And just to reinforce that, I looked at some figures this morning. And all these states have increasing number of new cases. Not deaths, the number of new cases. The deaths, of course, follow on later. So Alabama, Virginia, Wisconsin, Arkansas, California, South Dakota. The numbers of cases are all currently increasing. And regrettably, I think we'll probably see an increase in these cases as a result of the current situation. I do hope not, because obviously most of the demonstrations and rioting are outside. But there is increased risk of aerosolization and droplet infection by people being physically close together, by people shouting and protesting, making noises with their vocal cords and all the droplets that come out as a result of that. And of course, just the pure physical contact has got the significant risk of increasing cases, even though it's outside. On the good point, states with decreasing new cases, Massachusetts, Connecticut, Rhode Island, Delaware and North Dakota, are actually reducing at the moment. But even in areas like New York, where there's been a very high incidence of the disease, it's been very badly affected. Even in New York City, according to the data that we have, which is limited, still only about 20% of people have had the disease. So we are not at the herd immunity stage yet. And in these areas, the level of immunity is going to be way less. Or presumed immunity is going to be way less than in New York City. So these areas could easily have a resurgence, a continuation, or what people sometimes refer to as a second wave. So I would just say try not to be too discouraged on the COVID-19 front, and keep doing what you're doing and have been doing successfully in terms of all the basic precautions that you are taking. Now, the United Kingdom. I'm going to look at some of the Office for National Statistics data from the UK, and the news is mostly good in terms of death. So let's look at that. Let's look at some of that now. Now, this is the number of deaths registered by week in England and Wales from the 28th of December 2019, way back then, seems a long time ago now, all the way up to the 22nd of May, which is the latest week that the Office for National Statistics have collected full data for. So these are this is the number of deaths here, and the red line is the number of COVID deaths. So we see that the number of COVID deaths has decreased sharply. This data here is confused by the bank holiday weekend, but the number of COVID deaths are decreasing quite sharply, which is good news, and as a result of that, the total number of deaths have also decreased. So definite downward trend there. Now, this line here, you might remember this graph, it's useful. This is the average here, the 5-year average along that line. So the green deaths are non-COVID deaths and the blue deaths are COVID deaths. So here we can see that the deaths were slightly below average because it actually wasn't too bad a flu and influenza season this year. So over the flu season, things weren't too bad. But then, of course, all the COVID deaths are above average because normally we've had no COVID deaths in the past 5 years. And as we expressed a lot of concern about at the time, there was increasing non-COVID deaths during this period. The increase in COVID deaths we would expect, but the increase in non-COVID deaths Was that partly due to deaths by COVID-19 which weren't attributed, or was it due to the fact that people weren't accessing healthcare? And we now think it was because people weren't accessing healthcare that this excess of deaths occurred. But in this last week, the weekend in the 22nd of May that we see there, weekend in the 22nd of May, the deaths from other causes were actually slightly below the 5-year average. And the deaths from COVID-19, as we see, have started to go down as the lockdown measures have taken effect, albeit with a delay. So this graph is actually showing three things. It's giving us the age demographic of the population, which is useful for comparison. In blue, it's showing us all deaths. And as you would expect, the older people are, the more likely they are to die. So we can see the increase in deaths with increasing age. But we also see a clear trend with the COVID-19 deaths in yellow. And again, we see that quite clearly, that as age increases, the likelihood of death also increases. And it's good to compare that against the population demographic. So if we're comparing the number of COVID deaths in the older age group with the number of people that are actually alive in that older age group, we see there's a disproportionate number of older people dying as a result of COVID-19 compared to younger people. So that's very much confirming the trends we've been looking at for some time now. Now, this is the number of deaths involved with COVID-19 was highest in females aged 85. So this is right, let's look at this. So blue is the, obviously we have the age group here at the bottom. Blue is men, the yellow colour is female. So we see more men in that age group dying, more men in that age group dying, more men in that age group dying, more men in that age group dying. But in the 85-year-olds and older, we see more women dying. And I think this is because men tend to die at a younger age than women normally. So there are more women in this demographic grouping normally. So there's more women available to die, as it were, in that group. I think that's what probably accounts for that apparent discrepancy. Now, we've looked at this graph for a few weeks now. We've got used to this one, I think. So these are the number of COVID deaths, only looking at COVID deaths. And this is where people die. So in the blue, we see the number of deaths in hospital. And in the red, we see the number of deaths in care homes. And there we see the number of deaths in people's homes. And the blue is deaths in other places. So first of all, we see the number of deaths going down there. So the total number of COVID deaths is going down. But we still see that quite a good proportion, or quite a high proportion, I should say rather, of those deaths do occur in care homes. So even though the numbers are improving, still more work to be done there in the care home situation. In a sense, you would expect more deaths in hospital because people go to hospital when they are more poorly. But still more work to do there in the care homes. But good to see that this number is coming down really quite dramatically as a result of the lockdown measures filtering through. Less infections equaling less severe cases, going on to less deaths. The number of deaths registered in the UK decreased in week 21, which is here. This is the week ending the 22nd of May. So this is the blue line is total deaths, and the yellow line here is COVID deaths. So again, we see the number of COVID deaths going down, which is good. So that was some interesting things from the UK. Now, other things that caught my attention from the UK. Neil Ferguson, you might remember, he had to leave his government position as a result of breaching the terms of the lockdown. But he wasn't dismissed through lack of technical competence or anything like that, much as people will argue with him. But he's been saying some interesting things. Now, the first thing he says I haven't noted here, but I think he's made a very good point. What he said is that what he would expect, and this is kind of a gut feeling I think he's expressing, but I must say I've been thinking along similar terms, and I know a few other people have, that even though we're lifting the lockdown measures now in the UK, I don't really expect the number of cases and deaths to go up dramatically. Now, this is despite there's going to be more social contact as shops reopen and things like that. And the reason I don't expect the cases and deaths to go up dramatically over the summer is because in summertime people have good ventilation. They do a lot of things outside and there's plenty of fresh air around. We're not all huddled together over radiators or whatever it is to keep warm with the windows shut. And we know that a big factor in getting this infection is the viral load that gets into your lungs. So that is so much lower outside with good ventilation. And also in summer, we get more sun exposure, so we make more vitamin D, which we know is a immunologically protective molecule. So over summer, I think these things are going to kind of balance out. They tend to increase the number of cases and filtering through to the number of deaths as a result of the increased social contact that we're now going to have. But unfortunately, what this means is that come next winter, when the influenza season starts, so we're thinking next November, December particularly, people are going to start closing the doors and huddling themselves in again. And then as well as the influenza virus spreading in those more confined, non-ventilated situations, COVID-19 virus is going to spread as well. So I think we're going to see a great increase as winter starts, because we're not going to have herd immunity by then. I think that's when the cases are going to start. So we've had quite a few cases now. That's going to level off, I think, and then it's going to go up again towards the end of the year. And the reason that is so concerning is a proportion of people will get influenza and COVID-19 at the same time, and that's bad. That's got a bad prognosis. So I think I agree with what Neil Ferguson's saying here, that we may well see a flattening over summer, but the second wave is more going to be autumn and into earlier winter. So I think that's probably what we're going to see in the UK at least. Now, he also reports to the House of Lords that genetic analysis shows that strains in the UK come from Spain and Italy, and that many thousands of infected people came into the country in February and early March from Spain and Italy. So a lot of these were caused by people popping over to Italy for a bit of skiing. If only we'd closed the flights down earlier, we wouldn't have had this outbreak in the UK. That's where nearly all of it came from. It's from Spain and Italy. That's where our spread came from. That's looking at phylogenetic analysis of the viral particles. So, to be fair, it is what we were saying on this video, for example, back in February. But everyone just carried on flying, carried on going to football matches. This whole thing in the UK could have been virtually prevented. It would still be there to some degree, but nothing like as much. Now, let's move on to some good news. And good news comes from the Antipodes, Australia, New Zealand. And this is the bulletin board from Australia. So the total cases haven't gone up much. The total deaths is 102 and the recovered cases is going up. Now, if we look at the current cases in intensive care in Australia, we have 2 in Victoria, 1 in Queensland, 1 in New South Wales in intensive care. And if we look at the number of patients in hospital, we have 11 in New South Wales, 2 in Queensland, 2 in Tassie and 9 in Victoria. So the trends are looking very good for Australia, and that's confirmed by the graph, a daily number of reported cases, and we see that's still way down. Now, do notice it hasn't gone away. It's just way down. And we did see a similar situation in South Korea, where the cases were virtually gone, and then there were odd clusters coming back. So Australia's not completely out of the pandemic yet, but it's looking very promising. And this is just the cumulative deaths by age group, and it's a very similar pattern to the one we've just seen in the UK, with more deaths amongst men at virtually every age group, more there, about the same there, slightly more women perhaps. More men there, more men there, more men there, but more women there because these men have already died and there's more women left in the demographic. So overall, pretty good news there from Australia. Really pleased about the Australian situation. And New Zealand, I think, is going to lift some of its final lockdown measures. So the virus has almost gone from New Zealand. They've done remarkably well. Now, while we're looking at the graphics, I think I'm just going to show you Sweden, which, to put it mildly, has been interesting. We've talked about it many times. I've had quite a lot of feedback on it. And this is the new confirmed COVID-19 deaths, 7-day rolling average to give an average figure. And we see that Sweden, the death rates, and remember these are logarithmic scales. So that's 1, 10, 100. So this is a lot higher than that. It's a logarithmic scale. So we see the deaths in Sweden are higher than Denmark, Finland and Norway. So from that, it would appear that the Swedish policy has failed relative to the countries around about it. But of course, the population in Sweden is about 10.5 million, just over 10 million, I think. Whereas in Denmark, Finland and Norway, it's about half that, because Sweden is the most populated country in Scandinavia. So let's look at that now, adjusted for population. And again, you have to remember that this is a logarithmic scale. And we see that there's a nice flattening out now. Let's go in a bit. There are the figures. And remember, we're on a log scale here. So we see the new cases, new deaths decreasing. Norway's pretty well flat. Finland, pretty well flat. Slightly up there, maybe. Denmark, again, pretty well flat. Slightly up. Sweden, more of an upward trend. So the trend is still more upwards in Sweden compared to the countries round about it. And of course, the number is way higher, because remember, this is a logarithmic scale. So that number there is way higher than that. And I think that's a fair comparison, because these are the other countries in Scandinavia. So I think that probably makes a fairly fair comparison. So just to summarise there, I fear for greatly increasing cases in the States over the next weeks and a month or two. The UK looks like it's going to flatten out through the summer, but then pick up again in autumn. And of course, that situation applies to the States as well. The virus isn't going to go away from the United States by autumn, and there could also be a synergistic effect in the United States with the increase in cases of influenza and COVID-19 at the same time, which is going to be a bad combination. So they took 176 observational studies that they were able to find in the literature, 16 countries on all continents apart from Antarctica. And the total number of patients or subjects they were able to come up with was over 25,000. The number was over 25,000. And this included data from the COVID-19, the severe acute respiratory syndrome and the Middle East respiratory syndrome, which are the 3 types of coronavirus main pathologies that we've had trouble with. Now, no randomized controlled trials were detected in the literature. Now, this is incredible. No randomized controlled trials. So governments are paying universities and academics a lot of money to do research, and nowhere in this whole wide world has any academic group decided to study the effects of transmission of coronavirus using face masks or eye covering or physical distancing. They just haven't bothered to do it. It really makes you wonder why we're paying them this money. Anyway, this group of academics has put together what we've got, so we'll go with what we've got. First one, physical distancing. Now, just before I go on to these results, we have to realise that the risk of transmission when you are close to someone depends on 2 factors. There we are. It depends on 2 factors. It depends on how close you are to someone and how long you are close to them. They're the 2 factors. So the closer you are, for the longer, the greater the risk. But this study was unable to take into account the period of time but it was able to take into account the distance. And what they found is if you're less than 1 metre away, your risk of getting infection from an infected person is 13% risk. More than 1 metre away goes down to 3%. And if you're, for every other metre that you're further away, so if you're 2 metres, that would halve again. If you're 3 metres, that would halve again. So we see this huge distance when we go over 1 metre distance. And 2 metre distance would be half that again. So a safe, fairly safe distance is going to be 2 metres. More than 1 metre is a lot better, but that's just the way they could analyse this data. So 2 metres is a safe distance, reducing your chances of getting infection to about 1.5% compared to about 13% if you're closer than a metre. So that kind of ends the debate on physical distancing. The greater the distance, the less the chances of getting the infection. I suppose that's fairly intuitively obvious anyway, but it's nice to have the data on it. Face masks. They were able to analyse data from 2,647, and they found that wearing a mask, if you're in close contact with someone and you are wearing a mask, this is you to protect yourself wearing a mask, you have a 3% risk of infection. If you're not wearing a mask, your chances of getting infected go up to 17%. Now, for ages, of course, we've been saying that if I'm infected and I wear a mask, I'm protecting other people from me. That's true. But this also shows that me wearing a mask is going to protect me from infected people. And the risk is that if I'm not wearing a mask, I've got a 3% risk. So if I am wearing a mask, I've got a 3% risk. If I'm not wearing a mask, I've got a 17% risk. So do you want to reduce your chances of getting infection from 17% down to 3%? If the answer to that is yes, then wear a mask. So that's interesting on protecting people wearing masks. I was quite surprised by the difference there because, I mean, as I say, for ages we've known that wearing a mask is good and it's a big effect if I'm infected to protect you. But this also means I can protect myself from you if you are infected to this degree. 3% versus 17% risk if I'm not wearing a mask. And there was a stronger association with N95s or similar respirators, of course, as you would expect, as you might wear, for example, in a healthcare situation where there's a much greater risk. And eye protection was associated with less infection as well. This was interesting because the infection can also get in through the eyes, of course, and that showed up to a 22%, the odds ratio of adjusted odds ratio of 0.22, which is a 22% level of protection by wearing eye protection. And again, the risk of getting infection through your eyes is going to be increased with increasing physical distance, but that study couldn't really account for that. So interpretation of this, quantitative estimates for models and contact tracing policy. So this can be fed into the way that we adjudicate as who is at most risk of being infected from an infected person. But we do need robust randomised trials, and so far we haven't got any despite all this money we're paying to academics. So disappointed, but we haven't got any. So this systematic appraisal of current best practice is the best thing we have available. And the World Health Organization, who currently say 1 metre distancing is enough, need to reappraise their guidelines up to 2, I would say. Now, I just want to show you a few pictures I've received from Malaysia. That was interesting. This is just one of someone who's written into me with contact in Malaysia who went for a trip to the post office. So they had to queue outside with good social distancing, so that was good. And then they had the temperature checked on the way in. And inside a lot of the seats were closed off to ensure physical distancing. And there was good lines for waiting and physical distancing. So I just thought that was, of course, this is happening all around the world now. This is what has to happen as we seek to reduce the level of spread. All I've got to do now is show you some of my favourite people for Tuesday. And here they are. This is Alan, who watches in New Zealand. Oh, that's quite a while back. Sorry about the delay there, Alan. Send that on the 20th of May. Good to see you watching in New Zealand anyway. This is Anna, who watches from the Ukraine, over there in the east of Europe. Good to know you're watching over there. 2,000 international units of D3 sounds good to me. This is Anna Marie, who watches in New York. So interesting, fairly typical New York scene there, I think, out the window, Anna. But thank you for sending that in, and thank you for watching in New York. Another Anna in Tasmania, south of Australia. Thank you for watching, Anna, in Tasmania. Antoinette, who watches in Sydney, also in Australia. Homemade mask, Antoinette, excellent. That will protect you, and it will protect others, according to current data. Arthur, who watches in Perth. A lot of people seem to be in Australia today. Good to know you're watching out there in WA, Arthur. Arvin, who watches in Ontario, in Canada. Good to know you're watching in Canada. And Ash and Adrian, also in Australia. Great to know I have people watching on the other side of the world. Thank you for watching. Ash and Adrian. And this is Bernard, who watches in Singapore. Good to know you're watching in Singapore. And this is Betsy, who I believe owns Nessie. And Betsy is too shy, I believe, so she's quite reasonably put in Nessie. And this is in, I think this might be in Pennsylvania. And this is Danette, who watches in California. And I think Danette is a lab technician from what I remember. But great to know you're watching in California, Danette.